Now let's look at your Mallampati score. This is an assessment that is used more and more within sleep clinics as a screen for obstructive sleep apnea. There has been research showing that higher classes of a Mallampati score, so class 3 and 4, are associated with higher AHI and snoring. So AHI is an indicator of obstructive sleep apnea. The higher the AHI, the more severe the sleep apnea. A Mallampati score is not a diagnostic test for obstructive sleep apnea. Rather, it is a screening tool to use in combination with other screening tools and to understand when it would be more appropriate to see a sleep specialist or undergo a sleep study. If you click the link below, there's a link specifically to a photo that shows you the different classes of Mallampati score. This will help you as we walk through this. So do this test lying on your back just to standardize it as much as possible. If you've been doing the rest of these tests on yourself, have someone else do the assessment part of this one for you. And if you're doing this on your child, you should have no issue with this unless they're much too young to follow instructions. And in that case, go on to the next part of the assessment. So you're gonna lie on your back, and the person who's viewing or doing the assessment is going to be at eye level of the mouth. The person's going to open their mouth and stick their tongue out, so it will look like this. Okay, and the viewer is going to look into the back of the throat. So anatomically, what you're going to see is we have a hard palate here, which is your maxilla and your palatine bone. And then just behind your palatine bone here is a soft palate. So that soft palate is a combination of soft tissue, including connective tissue and muscle. And at the very bottom of your soft tissue is your uvula. So your uvula is that dangling piece of tissue at the back of the throat. We're going to use the uvula to help us grade our Mallampati score. So if you open the mouth and you stick the tongue out and you look to the back of the throat, and you could use a flashlight for this one if you're having a hard time with the lighting. If you only see the soft palate, the hard palate, and there's no visualization of the throat, then this is going to be a class 4. And again, follow along with the photo that's posted below. If you see the arches of the back of the throat and you see just the very center or top part of the uvula, that would be a class 3. And if you see the arches of the back of the throat and you see the entire uvula, but that the tongue cuts off the rest of the throat just at the bottom of the uvula, that's a class 2. And then if you see the entire uvula, you see the arches of the back of the throat, and then you also see space underneath the uvula so that you can see into the back of the throat even more, that would be a class 1. Again, class 3 and 4 have been correlated with increased snoring and a higher AHI, which is indicative of obstructive sleep apnea. If you are following along on your self-assessment form, just circle which one you are seeing. And then if you have any questions with this one, or if you don't have an assessment form, click the link below and enter your email address, and a full myofunctional therapy assessment form will be emailed to you so that you can follow along as you do this test and all the previous tests as well. If you have specific questions, please write them in the comment section below, or you can find me at summerspt.com, or you can reach out to your local myofunctional therapist.